So any of your pulmonary, like patients who have a pulmonary history who complain of shortness of breath or having like dyspnea on exertion or dyspnea in their sessions, one of the most effective breathing techniques for that is pursed lip breathing, which I think a lot of therapists tend to use and don't even realize, you know, truly the significance behind it. Cueing the patient to like breathe in through their nose and then blowing out through pursed lips. And that is a breathing technique that is very effective at helping to control dyspnea. So again, your patients who have a pulmonary history, that can be a really great technique to keep in mind if they're getting short of breath. So that's a really good one. Another thing to think about is somebody who has COPD, like specifically emphysema. A lot of your patients with emphysema tend to be upper chest breathers. You often see that they have like really elevated shoulders and they're kind of rounded forward here and they're hypertrophied in their accessory musculature. And so they're not using their diaphragm as well. So even encouraging diaphragmatic breathing or teaching them to use diaphragmatic breathing, because that will help to improve the air and like the oxygenation that is getting in throughout in their body. If they're moving more air into their lungs, they're going to get more oxygen and that out into the body as well, which will help improve their activity tolerance. But yeah, I think it's really important with all of our pulmonary patients for us to kind of take a step back and just watch their breathing. What does their breathing look like? And if they are getting really short of breath, to give them those cues of pursed lip breathing, of course, letting them take adequate rest breaks. A lot of your pulmonary patients too with shortness of breath or with dyspnea will rely on, what we'll call like a tripod position or professorial position, where they're leaning forward on their forearms. And I know you can't really see me there, but leaning forward on their forearms, like resting them on like the armrest of a chair, or resting them on their thighs. And you'll even see patients do that with a walker, where they lean forward and are resting their forearms on the walker. And I think our initial instinct as PTs is like, sit up straight, sit up, get out of that posture. Because right, it's this like forward flexed posture. But that technique also helps to control symptoms of dyspnea. So it can be another technique to use with patients to try to help manage the dyspnea. So I think just being aware of some quick and easy things that you can instruct your patients on to try to help control shortness of breath if they have that in their history. Because I think too often pulmonary patients especially, they appear to have very limited activity tolerance. And I've heard PTs say like, I just don't really think they're appropriate for PT. They can't tolerate a lot. Like the stuff I would normally do with this patient, I can't do with them. But I think if we as healthcare providers take a step back and help them work through some of the pulmonary symptoms, then they typically are able to tolerate a lot more of the activity.